Canine Hip Dysplasia by Devin Gregory. Canine hip dysplasia is considered a loose fit or laxity of the hip joint that can be caused by a deformity in growth or in mature dogs, with the buildup of scar tissue around the joint called osteophytes or bone spurs due to loss in cartilage of the joint area. The coxofemoral joint or hip area is a ball and socket joint. The femoral head or the ball and the acetabulum or socket are the cause of the continual abnormal movement of this joint. The femoral head is located on the femur or thigh bone at the lateral rear limb. The hip socket is located at the pelvis or acetabulum, should sit dorsal to the femoral head. Acute cases, there are limited signs, if any, such as ingrowth platelets, where genetics play a role. In fact, some don't show any signs of discomfort or lameness at any stage. Chronic cases such as arthritis, the dog may display physical discomforts or reduced movement or no movement at all of the affected limb. And in most cases, the physical signs of the canine are used, such as lameness of the limb or changes in behavior, and this can then be tested further with special positioned hip x-rays and special palpation methods to determine the laxity of the joint. Canine hip dysplasia is a common condition that is normally in larger breeds, but can also be diagnosed at an early age with genetic testing or x-rays. It can be detected and treated early with common anti-inflammatory medicines so that further damage does not occur. Signs to look for are lameness pronounced after exercise, bunny hopping, joint laxity, reduced range of motion, pain during full extension or flexion. This is stretching or bending. And further treatments involved osteotomy, which is a surgical procedure. And there are two different types. You could have a double or triple pelvic osteotomy. In chronic cases of hip dysplasia, the excess wear and tear develops osteoarthritis. This is inflammation of the joint membrane and cartilage due to deterioration of the cartilage in the hip joint. It also occurs in the hips, tarsus, elbows, shoulders, and carpi. Signs to look for are stiff hind limb, waddling, sitting with legs out straight or on one hip, and difficulty getting up. Clinical support would include radiographs, joint fluid analysis to show any increase in monocytes, or an arthroscopy, which evaluates the joint surface to identify the severity of the condition. Other imaging, if needed, includes MRI to evaluate soft tissues and CT to detect bone structures.